Welcome everyone. Thank you for joining us for today's webinar. My name is Meenu Agarwal and I'm working as Assistant Professor in Department of Biotechnology, NIET. Today's webinar will be presented by Dr. Deena Elsori on the topic Taking Charge of Your Health. Dr. Deena Elsori is the Associate Dean of Student Affairs at Abu Dhabi University, College of Health Sciences. Dr. Deena achieved several significant milestones and have been credited for being a top-performing professor with excellent team leadership capabilities, constantly instilling a plethora of knowledge in students. Her accolades included achieving the Distinguished Faculty Teaching and Service Awards several times throughout her career at Abu Dhabi University. Before joining Abu Dhabi University, Dr. Deena was a postdoctoral fellow at Cleveland Clinic, Ohio, United States. Her research focused on studying pathways that contribute to the progression of chronic inflammation and heart disease. Currently, her research and interest is focused on public health, and she has become an advocate for well-being and health promotion in the UAE. Now, without further ado, we'll turn the time over to Dr. Deena. We welcome you, ma'am.
Thank you very much. Thank you. It's my pleasure to be with all of you this afternoon. Before I start, I'd personally like to thank Dr. Fahad Khan and Dr. Rashmi Mishra for giving me the opportunity to talk to your faculty and staff all the way in India and across the UAE. Special thanks, of course, to the Department of Biotechnology at Noida Institute of Engineering and Technology. So with that, I will be sharing my slides right now. Thank you very much for everyone who's joining us this afternoon. So yeah, I was approached by Dr. Khan he said, you know, we want you to present to us something that is of interest to you. You know, he thought I'll be talking about cell biology, something that I've been, you know, very passionate about, and I've got good training in, especially working at the Cleveland Clinic in Cleveland, Ohio. But then I told him, you know, something that is more relevant, I think, these days, and I'm more passionate about, and being an advocate, especially here in the UAE, is actually our wellness and well-being. And I told him I can give a general seminar on what I call taking charge of your health, and that's what I'll be doing today. Feel free if you have any questions. I believe we'll be able to take some towards the end of the session. So just again, I know I'm not sure how many of you are familiar with the case with the leading causes of death in our country here in the United Arab Emirates. Just like everywhere else in the world, heart disease is still the leading cause of death in the UAE. But unfortunately for us, number 2 is the unintentional injuries. And I don't know how many of you have been to the UAE. It's really sad to see such data because we've got great highways. Everybody's driving good cars. You know, the weather conditions are not, you know, limiting our visibility whatsoever. We've got cameras everywhere, lots of policies and laws and, you know, fines as well. But of course, it's the behavior of the young people that we need to change. And it is a public health issue here in the United Arab Emirates. Cancer comes after that, respiratory disease, and so on. And so these are the things that are considered to be a priority when it comes to public health in the UAE. So for that, the priorities for us here in the health sector and for public health, you know, professionals is to look into cardiovascular disease prevention and management. That's still the #1 priority in the UAE. Road safety, as I said, unfortunately, it is a public health issue here. Tobacco control is still a problem. Communicable disease, and I think, you know, if we talk about communicable diseases, it should be #1 this year, because when you talk about communicable diseases, we're talking about infectious disease, and obviously COVID-19 is a viral infectious disease. So that is top priority this year for, I think, the whole world. the prevention and control of this infection. Another thing is occupational and environmental health is a priority for us here. Mother, infant, and school health, cancer control and prevention, chronic conditions, including asthma, but of course not limited to asthma. And also a lot of our work is done on oral health and oral hygiene. And so this is just, again, to give you an idea of where we are in the UAE compared to the rest of the world and what are the priorities when it comes to public health. Okay, now let's kind of start with what I'm really here to talk to you about, which is to take charge of your health. You know, a lot of people say, but I've got family history and genetic predisposition to these diseases. Eventually, I'm going to get it. Well, you know, I keep saying, but still, there is a whole responsibility that falls on you when it comes to your health. You know, I kept telling my students when the pandemic started, you know, you are young, you are healthy, most of you, work on your health, improve your immune system. Eat well, you know, work on your stress management techniques, drink water. It is an infection that you can fight if you're young and healthy most of the time. And that's why you see people that are more vulnerable and older are the people that are suffering the most. So there is a responsibility that we can do, especially when we are at a young age and obviously healthy. We don't have a pre-existing condition. So we can't always blame the genes. In fact, our research has shown it's 20% really is your genetic predisposition, 80% is your lifestyle. So we have to remember this when it comes to our health. It's what you do a lot of the time that triggers. You could be genetically predisposed, but the symptoms start appearing because of your lifestyle. What I want to emphasize is we no longer use the term healthy and unhealthy. We're shifting to this new health goal, which is known as wellness. Wellness, you know, when I tell my students, a lot of people ask, how are you? And you say, I'm well. Well, the question is, are you really well? Because it's not as simple as being okay. Wellness is actually achieving optimal health and vitality, your best health and your best vitality. You don't want to just be healthy. A lot of people say, oh, well, I don't have a specific diagnosis. I don't have diabetes. I don't have heart disease. I don't have depression. I don't have, you know, heart issues. So I am healthy. I'm not on medication. You're not even close to being well. If, you know, this whole assumption that I don't have a disease and I don't take medication, I'm healthy, needs to change. Wellness is really achieving your best health and vitality. And a lot of you will be surprised, but there's so much under wellness. And unfortunately, I think a lot of us, and we can't blame ourselves. This is the way kind of we were raised and taught to focus on the first dimension. And that's the first thing a lot of my students and my colleagues talk about. It's the physical dimension. A lot of people say, oh, you know, I work out every day. I'm physically active. I drink a lot of water. I sleep well. I eat well. I, you know, control my stress levels. But guess what? This is only one dimension of your wellness. It's only physical. And then you have to ask yourselves, actually, what about the rest? We have emotional wellness. We've got intellectual. We have social wellness. We have spiritual wellness. We have environmental wellness. And they've even recently added occupational and financial, because that's adding and that's affecting our health and adding a lot of burden actually on our health, especially these days, as you're probably aware of what's happening. And so, you know, typically, if I had the chance to engage with all of you, I would ask you, but then maybe we can, you know, some of you can comment on that at the end. I would ask you, where are, and this is how I would, you know, tell my students, where are your strengths and where are your weaknesses? So somebody could say, oh, I'm physically doing very well, but then I would ask, what about socially? How are you in relationships? How do you have enough, you know, social support system? Do you have friends? Do you socialize? Do you feel there's somebody there for you and people approach you when they need help? So this is something, you know, we have, because I get a lot of A students that are in good shape and healthy, but then I can see that they come to the lecture and then go home, no socialization whatsoever. Weekends, they're just stuck at home. And so obviously there's an area here that needs to improve. You know, when we talk about intellectual wellness, it's not about grades. That's the misconception we have. And again, a lot of my students would say, I'm an A student, I have a GPA 4 out of 4, I'm intellectually doing very well, not even close. And I'll tell you why in a second. Same thing with spiritual. A lot of people say, I practice a religion, whatever it is, and I'm doing what I'm expected to do, my religion. That's only a little part of spiritual wellness. Okay, so I want you to start thinking about these dimensions when you think about your wellness. And one thing you need to understand, that it's a continuum. Okay, it's connected. You can't say I'm doing physically very well, but who cares about emotionally, intellectually, and environmentally? One goes down, the rest will actually go down. That's why you'll never achieve that sense of satisfaction when it comes to your wellness if you're not actually trying to balance all of these. And notice in the figure that you're looking at right now, it's a two-way arrow, ladies and gentlemen. And it goes back to the title of my seminar, Taking Charge of Your Health. It's a choice you make, especially as a mature adult. We can't blame kids. Kids, we kind of, it's how the household is. They eat what you serve, they follow habits of their parents and so on. But as an adult, you should be able to distinguish what's wrong and what's right for your health. So if you look at the two-way arrow, you can decide to change. And obviously change means you're growing. And that means you achieve high levels of wellness, which starts giving you a vital and meaningful life. And that's where we want people to go, even if it's baby steps. I'm not saying I want you, to start running, every day, start sleeping 8 hours every day. If you don't do so, manage your stress, start, practicing spiritual. No, but at least you are shifting this way. However, some people decide to, unfortunately, neglect their health. This is when you start having physical, mental, and emotional symptoms, right? Which indicates low levels of wellness, and that could result in what we call malaise, which is exhausted. You're exhausted, and that leads to a disease. And sometimes, unfortunately, it's too late. Some of them is, these diseases are not reversible. You're going to start medication. If symptoms can get worse. Once you start having symptoms, the disease is there already. So in public health, what we talk about is prevention. Prevention. That's why you want to shift to high levels of wellness. Okay, and so you can see again, it's interconnected. You cannot neglect any area. We do have strengths in one area more than the other. It's perfectly fine, but we need to work on all of them. And some of you probably wonder, how do we do that? Well, guess what? There is a table that kind of summarizes for you the qualities and behaviors associated with the dimensions of wellness. Because a lot of my students would say, what do you mean by emotionally wellness? Oh, I'm not depressed. I like people. Does that mean I'm emotionally well? Well, then I ask them, let's see how it goes. So with physical, I think all of you are aware of them, and hopefully a lot of you are applying it. It starts with eating well, exercising, avoiding harmful habits, practicing safer sex, recognizing symptoms of disease, getting regular checkups. It's very, very important. And this is when I ask my students, how many of you see a doctor when you're not sick? How many of you do these regular checkups? And I can tell you 90% of the class will not put their hand up. We only go when we start feeling something is wrong. And unfortunately, that's sometimes too late. Okay, and avoiding injury. What about the emotional one? Emotional dimension. First of all, if you are working on your emotional wellness, or if you want to be emotionally well, you have to be optimistic. And I see a lot of people during the pandemic now that are very, very pessimistic. Oh, this is never going to end. That's it. Our life is never going to go back to normal. We're never going to get, even my students, we're never going to get jobs. We're never going to graduate. Well, guess what? We don't know the future. All we can do is try to be optimistic. I keep telling them, if we compare all of us, even I'm pretty sure, all of you in India, where we were in March up to now, things, we're better. We understand more about the virus. Unfortunately, it's still there. It's not, but we understand more. Different vaccines are in preparation around the world. They're looking into treatments. So we understand more. We're managing it more. As far as the UAE, I can tell you personally, the death rate is completely under control. The cases are going up as far as the infection, but the death rate is still 1 to 2 cases per day, although we've reached almost 1,500 infections. But it tells you that we can manage it better. So that's an optimistic view of the pandemic. The fact that I can give this lecture without traveling to India, all the way from the UAE, is very positive, right? By the way, I've been to India 3 times, and I would have loved to come and give you this in person. But I'm just saying, I'm in the comfort of my house now, giving you this lecture. We now use a technology that existed for years, but that we never used. Why put yourself in a plane and travel all these hours and get a visa and do this and expenses when we can do this? Yeah. So optimism is important. Trusting one another, guys, is under emotional. Self-esteem, self-acceptance, and self-confidence comes under emotional wellness. Ability to understand and accept one feeling. Do you understand others and do you accept their feelings, or are you defensive? Do you attack others? And ability to share your own feelings. So this is emotional. What about intellectual? Going back to what I told you earlier, a lot of students think, you know, and maybe not just, even the adults or even professors think intellectual wellness is about achieving high academic grades. It's not just that. It's being open to new ideas. And I can tell you a lot of people resist that, anything new. I'm sure some of you had the shock of their life when we all went from being on campus to going home. I saw now, this is when intellectual wellness kicked in. Some people resisted and said, I can't do this. I can't learn through a screen. And others says, okay, I have to adapt. And that's your intellectual wellness. Capacity to question, guys. Yeah, so the capacity to question, always, and this is a message to all of the students that are here with me this afternoon, always ask. Don't ever take it for granted that your mentor or instructor or professor is 100% correct. They can be, but ask why. It's something I teach my own kids. I've got 2 little boys. I always tell them to ask me why. Everything I say, if you, especially that it doesn't make sense to you. Ability to think critically, motivation to master a new skill, sense of humor, being creative, being curious, and lifelong learning. This is all under intellectual wellness. And then if we move to interpersonal, which is also known as social, communication skills are very, very important. Those that know how to communicate are socially much, you know, healthier than others. Capacity for intimacy, being in a serious relationship, ability to establish and maintain satisfying relationships, ability to cultivate support system, friends and family. Okay, this is all under social. What about spiritual? Again, a lot of us link it to religion. It's much more than that. It applies on humanity. Wherever you are, whatever religion you come from, capacity for love. And when I say love, it doesn't have to be a partner or significant other. Love life, love yourself, love what you have. Yeah, love good things for others, compassion, forgiveness, altruism, joy, sense of meaning and purpose, and of course, last but not least, sense of belonging to something greater than oneself. Yeah. Lastly, and I think we're all behind in this dimension, is the environmental aspect. And that's why in the UAE, we're very, very big on such initiatives when it comes to the environment. We've got our own degree in environmental health and safety. You know, sustainability and going green is a big initiative here in the country, because, you know, having abundant, clean natural resources is very important for your well-being, maintaining sustainable development as well. And this is at the level, obviously, of the society or the country. But then what can you do? Recycling whenever possible, reducing pollution and waste. These are the little things we can contribute to at the individual level. So do you see this? This is wellness, yeah? So when somebody asks you next time, are you well? Think about all of this. Are you really well? And of course, we didn't even add the occupational financial. That's a huge aspect as well that affects our health these days. Now, I'm not saying this is a checklist. You're not going to go home tonight and say, I need to do this. No, but think about all of this when you think about your well-being, ladies and gentlemen. Again, do not, shift away from just being stuck on the physical dimension. A lot of us link health to eat, drink, sleep. No, there's much more to that. You could be perfectly fit, perfect high blood pressure, blood sugar, weight, your BMI, but you're depressed, right? How is that going to work out? Or you don't have friends, or you're not able to love being alive, okay? So if you have any comments and questions about this, I'll be more than happy to address them at the end of my talk. This is a very, very interesting slide. It talks about the quantity of life versus quality. And this is when I usually ask my students, what's the message behind this pie chart? Yeah. So the idea here, if we look at the life expectancy of a person or of a society, let's say that person or that society, the average life expectancy is 78. People are dying at 78 years. the more important question is not how long they're living. That's an achievement if you live, you know, above 80 or 90 and so on, or even above 100. But the question is, what was the quality of your life when you were alive? So if you look at this chart in front of you, there are, you know, healthy life was for 66 years. However, the last 12 years was actually impaired. That means either in a hospital or somebody taking care of you, or, you know, someone who is not living, impaired, who's not functional. Well, if you ask me personally, I'd rather live, well, die at 66 years and, you know, healthy than live the rest of the 12 years being sick. So the idea here, it's not just pushing the life expectancy. When we say a country has a life expectancy of 90 or 80, well, let's ask ourselves, how many of these years are these people healthy? All right, because you know, now a lot of the funerals we go to, we hear this common statement, oh, they're relieved because they were in so much pain, they were suffering, the family was suffering. Well, we need to understand, you know, we want to hear, yeah, it's sad to be in a funeral, but it was also, it's nice when people die peacefully as well, without the suffering that a lot of people are going through in the last few years of their life. Okay, so remember, it's the quality, not just the quantity of life. So having said that, how do we reach wellness through lifestyle management? A lot of you probably think, okay, she's saying all this, but what do we do? Well, first of all, you have to start getting serious about your health. Yeah, and I think if you haven't before, this year is probably the most crucial year where you really need to start taking care of your health. You need to start examining your current health habits. A lot of us don't. And then if you've noticed that there's a lot of things you need to work on, you can't do it all at the same time. You need to choose one target behavior at a time. What is it that most bothering you? Is it that you're not sleeping enough? You're not sleeping at the right time? Are you smoking? Are you drinking? Are you, addicted to painkillers? Are you not eating healthy diet? Are you not drinking enough water? So choose one major target behavior. You have to start learning about the target behavior. You can't start the change without knowing what you need to do. And at the end, you can find help. Meaning help, it doesn't have to be professional help. We don't need to pay for this, but you can start reading about it. You can look at role models of people that changed successfully. There's tons of information online that's available for you, and it's for free, okay? Now, speaking of change, I think you all agree with me, change is probably the most difficult thing for human beings. And that's why a lot of psychologists actually have described change in stages. It's not just, you don't wake up overnight and you say, I'm going to change. It's a trans-theoretical model. It's the stages of change. And I think the first 2 points are the most difficult for human beings, which is going from what we call pre-contemplation to contemplation, meaning going from denial to acknowledging that you actually have a problem. A lot of us don't know that we actually have a problem with our health. And in general, but I'm talking about health in this perspective. So acknowledging the fact that, yes, that's it. I'm a heavy smoker. I know smoking can cause different kinds of diseases, not just cancer. And I know on long term, it's going to affect me. It's going to affect my family. It's going to affect the society. And I need to change. That means you've decided to acknowledge that you have a problem, or I need to lose weight, or I need to start managing my time. I need to start exercising more. So you've gone from denial to acknowledging. Then things come naturally after that. Once you have that mindset and determination that you need to change, the others will kick in. You start preparing for that change. Don't change overnight. You need to start preparing. Then, so you have a plan. Say, when do you want to start? How are you going to do it? And how long is it going to take you? And be realistic with your plans. Don't pressure yourself. And that would be followed by taking action. Okay, do it now. So you've planned for it. I don't know how long it's going to take you to plan, but then take action. And then that would be difficult as well. I think you would all agree with me. Yeah, maintenance. A lot of the time we achieve so much, but we kind of go back to square one. Maintaining it is difficult, but if you can do that, then I think you're done. You're ready to really make it a lifestyle now. And at the end, termination not of what you did, termination of the plan. Now it should be part of your lifestyle. Okay, it should be part of who you are, what you do every day. It comes naturally to you without having to think about it so much. And these are, you know, as I think it sounds complicated, but it's actually realistic. This is change. That's why a lot of people fail when it comes to change, because they don't think about it as a process. They think they can just get up in the morning and stop smoking, or, you know, stop drinking soft drinks, or start drinking much more water, or having fruits, or running. It just takes time. First of all, you have to prepare yourself mentally before you do it physically. Okay. Obviously, I'm given, you know, limited time to do this seminar. There's tons of things we can talk about when it comes to health issues, global health issues. Obviously, nutrition is one of them. It's on the top of the list. Physical activity is one of them. Being overweight and obesity is still a big issue. Tobacco smoking, substance abuse, of course, now this year, the year of COVID, mental health, injury and violence, stress, and environmental quality. Because of the time that I have, I'm just going to brush on 3 of them that I feel not the most important, but I think it's something that everybody should know about, and it will have a very, very clear effect on your life if you know how to manage it. So because obviously when we talk about nutrition, obviously what you eat is who you are. We all know a lot of our diseases is because chronic conditions that we have is because of what we eat. Nutrition is a critical part of health and development. We all know that better nutrition is related to improved, of course, it starts with infants, children, and of course, maternal health as well, the health of the mothers. That's why, as I said, I was telling my students at the beginning of the pandemic here, please eat better, you know, start getting your vegetables and fruits, drink more water, avoid all that junk food, avoid the stuff that will suppress your immunity. So the stronger immune system, the more you'll be able to fight infectious diseases, and in general, you'll be just able to, you know, there's so much around us. We travel a lot, so much exposure. The better the immune system, the healthier, and the more you'll be able to fight such infections. Safer pregnancy and childbirth, of course, when the nutrition is better. Low risk of non-communicable diseases, not just communicable, non-communicable diseases such as diabetes, cardiovascular disease, and so on. I know a lot of people that were diagnosed with diabetes, and they were able to kind of maintain the symptoms without medication because they, you know, changed their lifestyle. Of course, depending on how much they can manage that. But I'm saying, you know, one of my students was telling me that she was able to, you know, go on a very healthy diet and reduce her weight, physical activity, and was eventually taken off the insulin. Same thing with cardiovascular disease. And of course, that leads to long-term longevity, which is living long. I think we all know what this is by now. You know, I think you go around, this is the most word that I've been hearing this year, actually. I used to hear it a lot, but this year it's like, instead of saying hello, you say stress. It's the constant challenge. I think you all agree with me that it's something we can't avoid these days, not just because of COVID. Life has become very stressful, and I think everybody's stressed, whether it's kids or adults, male or females, whether you're working or not working, it's there. But the way I want you to think about stress is 2 different things. There's a stressor and there's a stress response. The stressor is the situation that triggers physical and emotional reactions. It's what makes you stressed, and it's there. Obviously, there are things that are not expected. There are things that happen that are out of our control. But the next point is what we call the stress response, which is the reaction itself. And obviously, if I was to ask you which one can you control, I'm sure you all agree with me that it's the second point. It's the stress response. And that's what I keep telling my students when I teach a whole chapter on stress. And I keep telling them, I cannot promise you a stress-free life. In fact, it's just going to get more stressful as you grow up and you become more responsible and have more responsibilities in your life. So the stressor will always be there. But what I need to help you with, and I want you to work on, is your stress response. It's like someone, going through something and just collapsing, having an anxiety attack or panic or, going all over the place, and somebody who is there calm and trying to solve the problem. That's how extreme it can be. Same situation, but people reacting very differently. Stress, just to let you know, it has been actually related to health problems, directly related to health problems such as heart disease, asthma, obesity, diabetes, of course, headaches, depression, and anxiety. That's why a lot of people are, if you look at the statistics worldwide for mental health issues, specifically depression and anxiety this year, it's gone up everywhere, including the UAE. I've got a lot of my friends who work in the area of psychiatry and psychology who tell me we can't keep up anymore. Appointments are scheduled all the way till next year because of the stress level that we're going through. It kicks in, all of this depression and anxiety. A lot of you probably experience gastrointestinal problem, digestion, bloating when you're stressed, Alzheimer's disease, and obviously that could lead to premature death. If we were to look at the common sources of stress in our life, of course, one of the major things is major life changes, such as what's happening to us right now with the pandemic, but that's not limited to just such pandemic things like, of course, moving from high school to college. I'm sure a lot of the students will agree with me. Getting married, having children, losing a job, starting a new job, traveling or moving to a new country. Any major life change can be very, very stressful. But then we have the little daily hassles, right? Things like traffic, rude people, the pressure of getting things done and so on. And then for those that are working, we've got a lot of job-related stressors. And for the students watching me this afternoon or listening to the seminar, I'm sure you all agree, your college stressors. And I tell my students, don't underestimate what you're going through, guys. There's so much that you're going through academically, personally, financially, socially. You're going through a lot. Don't underestimate. Being a college student is not easy. There's a lot of social sources of stress, whether it's real life or virtual now also. That's another problem. Environmental stressors. Yeah. Again, we're blessed in the UAE, but I'm sure, in India and other countries, there's a lot of environmental disasters, we know that earthquakes, tsunamis, and hurricanes, these issues are very, very stressful and it can affect societies and population. And then last but not least, internal stressors, okay? Things that are internally stress you, such as being sick or not feeling well. And these are the common sources of stress in life. Having said that, what are the common techniques that we use to manage stress? Of course, and I think I would agree, you would all agree with me that social support comes as number one. That's why a lot of us, if you're away from family or living abroad, that's one of the things you say, oh, I wish I had my family. I have a lot of new colleagues right now that joined our department that are new, that just moved from other countries, and I could see how stressed they are because they don't have that social support system they had back home. So that's very, very important that you have a system, you have people around you. Communication is also a key to stress management. Talk about it. And I keep telling my team as well, I'm leading a big team and I keep telling them we always have to communicate. Emails don't work. Come and talk to me if you have a problem. Of course, I think this should be number one, exercise, any kind of exercise. It has been shown to increase endorphins, serotonin and dopamine, make you happier, which will eventually release your stress. Eating healthy, by the way, nutrition affects your stress level as well. Sleeping well. For students, of course, time management, a lot of the time they come up to me, oh, I'm running out of time. I have so many projects, so many deadlines. Well, guess what? Your stress will be more controlled if you manage your time better. But what's important, identify individual stressors. A lot of the time people tell me, oh, so a lot of the time people would say, I would ask what is stressing you out, and they would say life, and then I would say, what do you mean life? Everything in life? What is it? You have to pinpoint, otherwise you won't be able to solve it. Okay. And for that, speaking of mental health, I have to share this with you. It's something we're very excited about, and we take pride in this in Abu Dhabi University. We were one of the first universities in the UAE to offer a full course in happiness and positive psychology. This course became an open elective. I mean, it's offered under the College of Health Sciences, but it became open elective for every single person or every single student in the university, whether they're engineering students, business, law, mass communication. People started coming to take this course with us. And what it does, it focuses on topics such as their strength, brings out their strength, optimism, appreciation and gratitude, positive communication, self-compassion. What we really want out of this course, and it's a course they take for a grade, you know, it's not like pass or fail. They actually sit down and they do the task and they do lots of projects. But we talk about motivation and goal setting to really have them become their best selves. So that's one of the initiatives we've done, because we've got our own Ministry of Happiness in Dubai, and there's a lot happening in this area. And so kind of to catch up with all of that, we said, you know, why don't we do something for us, for our students? And trust me, it made a huge difference. When students started signing up for this course, they opened up more. We started to know what are the mental health issues they're going through. Our counselor said, oh my God, since you offered this course, I've been seeing much more students. So it's something, these little things that you can do just to support, whether, again, faculty or staff or even students. Kind of, I want to, because I only have 15 minutes left, I want to leave room for any questions or comments you might have. My last slide is, I want you to remember being healthy for life is very, very important. You know, if you are healthy, you can make changes in your world. If you're not healthy, you're pretty much useless. Sorry to say that. You're not, I mean, being in a bed or in a hospital, you're not doing much to this, to your society and to the world. So making changes in your world requires you to be healthy. And you don't know what the future holds, right? So we never thought this is going to happen this year. Look at us, you know, who would have thought? So life is unpredictable. All you can do is prepare yourself. And when I say prepare, you prepare your health to combat any challenges, whether physical or mental or social, and so on. And that brings me to the end of my talk today. I hope you've enjoyed it, and I'll be more than happy to take any comments or questions from the audience. Let me just unshare my slides. Yep, so do we have any questions or comments? You are muted. I think you're still muted. No, you're still muted.
Dr. Pratibha has asked that what type of diet should be preferred during this COVID-19 scenario?
Yeah, thank you very much for this question. And this is the question that I've been getting from a lot of my students. I mean, of course, you know, what we talk about our immune system now with infections. So anything that would boost that immune system, which reflects vitamin intake. So you want to work on, you know, getting as much as fruits and vegetables as possible. Hydration is also a key. Drinking water and making sure you're hydrated all the time. If you have any vitamin deficiencies, this is the right time to get checked. A lot of people are not aware that they have vitamin D deficiency or vitamin B12. Then you need to start supplementing. But definitely I would work on, you know, getting the natural vitamins from our food, which is tons of them. Yeah, especially the vegetables and the fruits. Eat, you know, again, the good grains, always go for the good carbs and the good grains, and make sure you're getting your proteins as well. You know, protein is very much needed for immune support. Whether it's plant-based protein or animal-based protein, but always go for a high-quality protein. Yes.
Okay, Dr. Zakir has asked that what are the psychological effects of COVID-19 on children?
That's a very good question. Well, let me put on my mother's hat now. I'm a mother of 2 boys, and I would call them children. What I've noticed personally, the effect on my own boys is because of all that technology use and being on that computer, they are more isolated. I feel they're not as sociable, and so I think it affected the social wellness of every single child on this planet, just being on that screen. I've noticed as well, I don't want to say more aggressive, but they're not as patient as they used to be. And I would say because they're not doing physical activities, they're staying more at home. That's something that's reflecting their behavior. I saw more negative behavior. So, and I think a lot of kids or teenagers are going through severe anxiety. I've been hearing a lot of stories. Depression is becoming very, very common among the young age group as well. So yeah, and the social and emotional part has been very much affected negatively with the pandemic on young children. So we have to be very, very careful as parents with that. You are muted. I can't hear you.
Thank you, ma'am. Dr. Khan has asked how meditation can help to combat with the disease.
That's a very good point. I only started meditating regularly when the pandemic started. Yeah, so I'm a believer. I've been to, I'm sure all of you are familiar, I've been to Vanna Resort back in November, actually. I went with my mother to Vanna in India for a meditation resort. I used to think it's nice, it's needed, but then luckily I went in November and the pandemic happened in March. I was able to apply a lot of the things I've learned in that resort. I think meditation, from my personal experience, it really reduces your stress level and anxiety. So whenever I felt anxious or I'm overstressed, I used this guided meditation of breathing, and I started doing more yoga, and it definitely reduced stress level. I think personally, it made me calmer. It made me more patient. And every time now, if I feel overstressed or if I feel that things are getting out of control, just simple meditation breathing techniques really help me get out of this negative cycle. So no, I think it's meditation is very, very big when it comes to your mental health and well-being. And I think it's a very effective technique, and I think everybody can do it.
Okay, thank you so much, ma'am. Now I'd like to invite Dr. Khan.
Of course.
Thank you very much, ma'am, for a wonderful session.
Thank you. Thank you for the invitation.
Thank you, ma'am. So on behalf of Department of Biotechnology and Noida Institute of Engineering and Technology, I, Dr. Fahad Khan, just want to thank you a very hearty gratitude to Dr. Deena Elsori for your presence and for your very informative session, and aware the audience with your wonderful thoughts and guided in the current situation of COVID-19 pandemic. So many of us during this pandemic are experiencing mass trauma from COVID-19. Thus, I strongly believe that this lecture would definitely help us to combat with the current issues arises due to COVID-19. And we would be very happy to share this platform with you in future also. So thank you very much.
Thank you.
Time is restricted, and as you have already mentioned that you also attended a meeting. So
yes,
thank you very
10
much.
minutes my next meeting, but thank you very much.
Definitely we will meet you in offline mode also.
Thank you very much. And again, it was my pleasure to give a talk to your university and your students and faculty. And thank you for this wonderful invitation. I do wish you the best of luck, and we'll definitely stay in touch.
Thank you.
All right. Have a good day, everybody. Bye-bye.
Thank you, ma'am.
Bye-bye.
Bye.